Okay, let's start with our first section of lecture topic Puerperium. In this, we will discuss about the physiological changes. In the first section, when we will talk about the physiological changes that can occur in the puerperium, we will talk first about what is the puerperium and what's the actual definition of puerperium, and then how uterine involution takes place in the puerperium, and what are some genital tract changes, and what is lochia, which is present in the puerperium. So first the puerperium, and it refers to 6-week period. So 6 weeks after delivery, after the birth of the baby, or following the third stage of the labor, 6 weeks after the third stage of the labor. And what is third stage of labor? When the baby is delivered. The third stage of the labor is when the placenta is delivered after the delivery of the baby. Actually, the stages of labor, we already talked about this in one of our previous lectures, that we have 3 stages of labor. In the first stage of the labor is the beginning of the pains, regular pains, and then the cervix opens. And then in the second stage of labor, the delivery of the baby from the dilation of the cervix to 10 centimeter, and when the baby is delivered. And then the third stage is when the labor or delivery is complete, actually is with the delivery of the placenta. So third stage, after the placenta is delivered, from that time to the 6 weeks is the period known as the puerperium, or the postpartal period. So this is the time, so refers to 6-week period following the completion of third stage of labor, when considerable adjustments occur before return to pre-pregnant state. So it's important that we should achieve the pre-pregnant state of the person or the female after the delivery, and that usually takes about 6 weeks after the delivery, and this period is known as the puerperium. So 6 weeks postpartum or after the delivery, usually there is a regular obstetric visit during this period, and also after 6 weeks, so the doctor should know that all the organs come back to the normal pre-pregnant stage or pre-pregnant level. The important complication during this stage that can occur is the infection that can occur after the delivery, and this is there are few very common sites from which this infection can develop through one or more of these wounds. So the placental site is a raw wound with the gapping veins occluded by thrombi, a good culture medium. So one site from which the infection can occur during the puerperium is the raw area created by the separation of the placenta from the wall of the uterus, and then when it is separated, there is a raw area left behind, and that area is a very, very good culture medium for the bacteria. And then the second site is the cervix, nearly always torn even in normal delivery. So even during the normal delivery, there is usually a tear of the cervix or some injury to the cervix, and that is also the common site for the growth of microorganism. And then the third common site is the vagina, which is often control or involved in an episiotomy. If the no episiotomy is performed, episiotomy is the surgical incision given in the perineum to increase the area from which the baby is delivered. So if the episiotomy is performed, that is the site for the infection. If episiotomy is not performed, then the torn vagina or the injury to the vagina that occurs during the delivery is also the site for the infection. So now puerperium is the period 6 weeks following delivery, and it is the period during which normal physiological changes takes place, so the organs come back to the pre-pregnant state. And the common complication that can occur during this time is the infection, and 3 sites are very common for infection: the site of separation of placenta, then the other side is the site where there is injury or tear to the cervix, and then the torn vagina or if episiotomy is performed. So this is the puerperium. Early puerperium is, as I mentioned, it's a dangerous time because infections can occur at this time. Proper care of the patient during this period is very important. This is the time also when the patients or the pregnant women, they are vulnerable to different psychological disturbances. We will talk about this later on in the lecture in detail, but depressive illnesses are very common in this period. Then we have maternal deaths can occur in this period also, depending on if the proper management is not given. Infections are common that can spread, that can cause PIDs, that can cause different septicemias, and they can become severe. And then vigilant surveillance is important. Depending on the condition, the proper management should be given to the patient. That's very, very important for preventing of any complication and severities. Next, the physiological changes. First, we should know what is the physiological changes and what are the pathological changes. The difference between physiological changes are the normal changes that the body go through or went through to come back to the normal pre-pregnant level. Pathological changes are abnormal changes that can occur. So physiological changes are here. If you see in this diagram, this is the fundal height at the delivery. So each day the height of the fundus of the uterus decreases, and it comes to about the same pre-pregnant level at about day 9th. So it keeps on coming down and down and down and decreases every day. So physiological changes can be the uterine involution. Uterine involution is going back of the uterus to the normal pre-pregnant state or level. At the time of the delivery, the fundus is almost at the level of the umbilicus, and then it comes back to normal slowly every day. It keeps on involuting or regressing. Then we have some genital tract changes, and then the lochia. These are the normal physiological changes that occur in the puerperium, and if they are present, it means it's normal. There is nothing to worry about. So these are normal physiological changes. First, the uterine involution. Here, if you see, this is the after dropping, this is the uterus at about 9 months. So all the way up to the top of the abdomen to the about the xephisternum level or so. So all the way up. 9 months after the baby drops down, after dropping, it is at about this level, which is the level of about the 7-month uterus. And then this is the 3rd month, 4th month. So all these are the measurements of the uterus at different levels or different gestational periods. So uterine involution, what is uterine involution? Is the process by which postpartum uterus weighing about 1 kilogram. After the delivery of the baby, the uterus is still weighing about 1 kilogram. And with uterine involution, it comes to about less than 100 grams. Which is the pre-pregnant state of the uterus. So after the delivery, the uterus weighs 1 kg or 1 kilogram. The normal weight of the uterus is about 100 gram. So all that is reduced in the period which is known as the puerperium, and it comes to the normal pre-pregnancy weight. It occurs by autolysis. And after delivery, what occurs, uterine fundus is about 4 centimeter below the umbilicus. So after the delivery, the fundus is about 4 centimeter below the umbilicus. So it's high up in the mid-abdomen, about the mid-abdomen. And then after that, then uterine fundus comes to 12 centimeter above symphysis pubis. And then finally, by 2 weeks, not palpable above symphysis pubis. So all this involution takes place in about 2 weeks. As we saw in the previous slide, that each day it keeps on regressing and involuting, and then it can be just by 2 weeks, it is not even palpable above the symphysis pubis. Symphysis pubis is the area where the two pubic bone come and combine together. It's a very, very important landmark in obstetrics. So above the symphysis pubis, if it's not palpable, it means it's in the normal physiological state, or it is regressed to its normal size. So at birth, after delivery, it's about the level of 4 centimeter below the umbilicus, and then it regressed to about 12 centimeter above the symphysis pubis, and about by 2 weeks, which is about 14th day, it is not even palpable above the symphysis pubis. So this is normal physiological change. If this is not occurring and still uterus is palpable after 2 weeks and it's painful and there is some spotting, it means there is some pathology going on and it's not normal physiological changes. So that's important to know what's the normal changes that can occur in the puerperium. So this is uterine involution. In uterine involution, there is no effect on the muscle cells. A protein absorption, and this uterine involution is accelerated by oxytocin release. Oxytocin is the hormone that helps in the contraction of the uterus, and it also causes production of the milk. So this is very, very helpful in the uterine involution, and it plays an important role in the involution. Signs of delayed involution. Artifacts and full bladders. If there is delayed involution, how it is recognized that the involution is delayed? There are artifacts and full bladder. on the ultrasound or examination. Then there is loaded rectum and fibroids. Rectum is also full and there are fibroids. Retained products of conception. Retained products of conception, usually pieces of placenta are retained. Placental retention is also common. Uterine infection. Uterine infection can also lead to failure of involution or delayed involution. And then there is broad ligament hematoma or collection of blood in the broad ligament. All these are the signs of delayed involution, and it includes the full bladder, loaded rectum or fibroids, broad ligament hematoma, infections that can occur after in the period or in the puerperium can also delay the involution of the uterus and the retained product of conception. Then what are some genital tract changes? Remember, we are talking about the physiological changes that can occur in the puerperium. So genital changes following delivery, there is lower uterus segment and cervix, it's flabby. So lower uterine segment is flabby after the delivery. Lacerations on examination, usually there are small lacerations of the cervix because of the delivery. Progressive closure of the cervix. External os remain open. So these are some genital tract changes after the delivery. The lower tract cervix is flabby. There are some lacerations. Progressive closure of the cervix occur, and then the external os of the cervix remain open. Assessment of postnatal cervix. So this is all the assessment changes that occur in the cervix after the delivery. Next, what is lochia? The blood-stained uterine discharge that is comprised of blood and necrotic decidua. So lochia is the uterine discharge. After the delivery, there is discharge which is blood-stained and necrotic tissue. This decidua, which is the site of the attachment of the placenta. So that is also in that secretion or discharge. So that's the lochia. You can see it's more immediately after the delivery, and as the days passes, it comes less and less, and sometimes it even stays a little bit spotting until about the 6 weeks or into the entire puerperium. It's a necrotic superficial decidua, basal layer regeneration, first few days after delivery. So usually it's first few days after delivery, but sometimes it stays longer, but it should be gone in before the 6 weeks after the delivery, and it's comprised of necrotic decidual layer or tissue, and until the regeneration or growth of that raw tissue takes place, usually that lochia stays there. We have different types, 3 types of the lochia. We have lochia rubra, which is red in color, which changes to pink slowly. And then we have lochia serosa, and the third type is lochia abba. So these are the different types of the lochia, and initially it's bright red, slowly it changes its color. If there is persistent red lochia, it means there is delayed involution, and as we mentioned before, the different factors can cause delayed involution. Infections in the after delivery is one reason in which there is persistence of lochia. Because of the infection, the regeneration process is slowed or is affected, and then there is constant presence of lochia and bloody discharge, and there is lower abdominal pain, discomfort. All these changes are present. So this was all about the section 1, in which we talked about the physiological changes in the puerperium. Thank you for watching sqadia.com.